An oral temperature is measured with a tympanic membrane thermometer. This easy-to-use thermometer makes it easier to measure the temperature of children younger than 6 years of age, uncooperative patients, and those who cannot have their temperatures taken orally. Don't use a tympanic thermometer if the patient has an inflamed ear canal or if there is a discharge from the ear, such as blood or pus. An excessive buildup of earwax or cerumen can cause a falsely low reading. A normal amount of cerumen does not affect the temperature reading. The thermometer has a sensor that takes a picture of the infrared waves given off by the tympanic membrane. The waves generate energy, which the thermometer calculates and converts to an oral equivalent. Sanitize your hands before proceeding. Assemble your equipment. Make sure you have probe covers. If the box is empty, replace it with a new one. Greet the patient and introduce yourself.
Hi, my name is Kim. I'm going to be your medical assistant for today.
Identify the patient and explain the procedure.
Okay, Caitlin, I need to take your temperature in your ear. Is that okay? Mm-hmm. Have you ever had that done before? Yeah. Okay.
Check to see if any external factors might affect the readings. These include lying on the ear, covering the ear with the hat or earmuffs, exposure to very hot or cold temperatures, or recent swimming or bathing. Remove the thermometer from its storage base. Examine the lens to be sure it's clean and intact. A dirty or damaged lens can cause a falsely low reading. If the lens is dirty, gently clean it with an antiseptic wipe and wipe it dry with a cotton swab. Next, you must apply a probe cover. The cover protects the lens and prevents the transmission of microorganisms from one patient to another. Press the probe tip straight down into the cover box to put a cover on the probe. You will see and feel the cover snap securely in place, which automatically turns on the thermometer. Pull the probe straight up from the cover box. Look at the digital display to see if the thermometer is ready to use. Hold the thermometer in your dominant hand. If the thermometer is in your right hand, take the patient's temperature in the right ear. Likewise, if it's in your left hand, take the temperature in the left ear. The ear canal has an S shape. You need to straighten the ear canal for the thermometer to get a clear picture of the tympanic membrane. For adults and children older than 3 years, gently pull the ear auricle upward and backward. For children under age 3, like our patient, gently pull the ear pinna downward and backward. Insert the probe far enough to seal the ear canal, but without causing discomfort. Point the tip toward the opposite temple. This site is located midway between the opposite ear and eyebrow of the patient. This position lets the sensor get a clear view of the tympanic membrane. Ask the patient to remain still. Hold the thermometer steady and press the activation button until you hear an audible tone. When the button is depressed, the infrared sensor in the probe scans the thermal energy radiated by the tympanic membrane. Remove the thermometer from the ear canal. Turn the digital display toward you and read the temperature. Caitlin's temperature is 99.0 degrees Fahrenheit. Make a mental note of the temperature reading. Discard the used probe cover by holding it over a waste container and eject it. Replace the thermometer in its storage base. This protects the lens from damage and dirt. Sanitize your hands and chart your results. Include the date, time, and temperature reading. Note the ear that was used, such as AD for right ear or AS for left ear. This tells the physician it was an oral temperature.